Hello, everyone. Welcome back to another episode of the AI Healthcare Podcast. I'm your host, Dylan Reed, and today we are joined with my friend, State Representative Michael Echols of District 14, representing Ouachita Parish. Michael, thank you so much for your time today.
Yeah, pleasure to be with you.
Awesome. And to dive right in, what led you into public service in the first place?
I've served now for right at a decade or more, from city councilman to state rep. But over throughout my entire career, I've always been involved in nonprofits, and I've always just had a belief that we need to give back in some way or another. And some years ago, after serving on several nonprofit boards and working in the community, just felt it was time to move on to a different level and ran for city councilman, won that seat, and then went on to run for state representative. Now I'm serving my second term. So it's been a pleasure to get to serve the people of this region.
Awesome. And a little bit, just some curiosity about the district. So, what is the story behind your district and the constituency that you represent in Baton Rouge?
So, House District 14, prior to our redistricting, which happened a couple of years back, I represented Morehouse Parish and Ouachita Parish, which is, a pretty large geographic area by way of a House district. But we went through redistricting. My district had grown, one of the few in Northeast Louisiana that had actually grown in population. So the district kind of shrunk down. We essentially represent 44,000 people each, give or take a few hundred or a few thousand folks. But now the core district is in Ouachita Parish, which represents Sterlington, West Monroe, and Monroe. It's a very concentric district that's really the business district for Northeast Louisiana and representing the heart of the Monroe market.
Awesome. And just out of curiosity, one district, what is the equivalent of in relation to people that you represent?
So our parish is about 165,000 people, and so I represent about a fourth of that. So it's a pretty tight district. Senators ended up representing about 120,000 people apiece. So when you look at other markets around the state, in my region, Ouachita Parish is one of the larger. Well, Monroe is one of the larger. I think it's number five or number six as far as largest cities in the state. The city of Monroe was about 47 to 50,000 people, so almost the equivalent of a city. But we have much larger cities throughout Louisiana.
Yeah. Well, and it's being from Texas, next door neighbor, it's a whole other animal going from North Louisiana to South Louisiana. It might just be two separate states.
It certainly is two separate cultures. You kind of have the Cajuns and the Acadians, and then these eastern side of the state with New Orleans and the Creole populations, and then you get up to the central, or I call the Piney Woods district of the state or area of the state. Then up here in the snow-capped mountains of the north. So it's a variety of cultures and a variety of geographic regions.
Yeah. And specifically, it kind of reminded me of, when I was younger, we used to drive from Dallas to East Texas because we had a friend and, we used to go out on her ranch. And it kind of Northeast Louisiana kind of reminds me a lot of East Texas, kind of that very open, very rural, like,
Yeah, and it depends on where you are too. I mean, between the Shreveport market to my market, I'm more in the Delta, so it's a flat plain of the Mississippi River. But then you get on the western side of my district, and it becomes hilly, and that leads you to kind of the Ruston Shreveport markets, which again are more piney rolling hills versus the more plain level stuff with the Delta here in Monroe.
yeah. And, it kind of reminds, so I did watch your TED Talk. I believe you gave a little over 10 years ago about kind of revitalizing the city of Monroe. And there was a story you told about you just walked into a shop one day and asked the guy like, "How much are you willing to sell this store?" And how have you been able to like connect with your constituency?
Well, there's two different thoughts there. One on walking in and trying to acquire downtown Monroe was deeply distressed, and there were a lot of vacant buildings. And so, over almost 15, 20 years ago, walked into downtown and started visiting with different people that own property and buying buildings one by one and trying to put them back into commerce. Because our downtowns, specifically downtown Monroe, West Monroe, and all of our small towns around Louisiana are rich in both culture and history. They just have been neglected. So our goal over the last decade has been to slowly but surely revitalize and put dollars back towards making that revitalization effort a reality. It is a slow and painful process, and again, we're 15 plus years into it. But out of my constituency and serving as a state rep, I think I kind of wear two hats. One as a service leader, but two also trying to lead by revitalization. I think that that can play a critical role, and I'll go around to my colleagues' areas throughout the state, trying to give them at least the development tools that I've figured out over the last 15 years. So whether it's utilizing a state or federal historic tax credits to revitalize historic structures, creating cultural districts, creating these economic development zones, so you can be laser focused in your restoration efforts. There's so many tools that are out there, but you got to lever them all the right way. This is very complicated to try to restore these buildings. They require so much more time, effort, and money. But the sense of place is there. People have been coming to these historic downtowns for decades, generations, if you will. So I think it makes a logical case of making that revitalization and investment effort.
Mhm. And you would think like just where Monroe is located within the state, like you're not far from Dallas, you're not far from Memphis, you're not far from Little Rock or New Orleans even. So you would like what has been the barrier or the blockage of kind of having that as kind of a city where people can live and kind of do business in?
I think a lot of the challenges we put in front of ourselves, just these mental barriers that we can't be a big little town. And so we've been trying to break down those barriers by making quality investment in high quality housing in our downtown, by making investment in high quality retail, and just trying to attract. So it's kind of like one of those things: if you build it, they will come. So all those efforts have been underway now for over a decade. We have a large boutique hotel that is under construction now that'll finish up this year. We feel like that'll be another incubator that'll drive traffic into our downtowns. And then it's not just about downtown Monroe, it's about downtown Monroe, West Monroe, the village of Sterlington, and all the other surrounding areas. Because, we're seeing now more and more large corporations look at smaller markets because of both drive time, infrastructure, and other things that are in place. Northeast Louisiana has a lot of that infrastructure in place. So I think you're starting to see people target these smaller communities that can develop a workforce, that have a college, that have a community college, that can drive their future growth without all the distractions of a large metropolitan market like a Houston or a Dallas or some other larger area that has a lot of other challenges logistically for their employees and people to have a quality of life.
Hmm. Yeah, so you're kind of really looking at it as Monroe, we're just not another town off of I-20.
Correct. I mean, it's a special town. This whole area is very special, and I think once people come here, they see that. My local mayor talks about there's something in the water. We have the Washita River that rides right through the middle of our area. We have bayous, lakes, and streams everywhere, and I agree there is something in the water that makes and it's our people. We have very special population that work hard, that like to solve problems, and I think that's what makes this area kind of a unique incubator for economic vitality.
Awesome. And that leads into my next question nicely. So you're heavily involved in the healthcare industry in Louisiana, such as serving on the director of business development for Affinity Health Group and Vantage Point Health Plan of Monroe, and being a board member of the LA Association of Health Plans. So how do you see healthcare specifically with the recent construction or the undergoing construction of the Meta Data Center in Richland Parish evolving to better serve the needs of northeastern Louisiana?
So, in I retired in December of 22 from Vantage, Affinity, and some other healthcare assets. I worked there for almost, 15 years, and it was a dynamic time because we were growing a physician group, we were growing a multi-state health plan, and I got to see a lot of the facets between the hospital, the physician group, and then the health plan, and what worked and what didn't work, and some of the things we worked on to try to innovate in that space. Healthcare is deeply, deeply broken by way of both delivery, the payment methodologies, how incentive alignments are aligned between providers, hospitals, and other payers. We've been in this fee for service world forever, and we need to be in both a quality payment, performance, and outcome based situation. Now, your question about Meta and the data center, I think that these data centers and the artificial intelligence and how that's going to play into future payment methodologies, future quality outcomes, coordination of care and benefit execution, all those things I think will evolve very, very rapidly and hopefully to the betterment of the patient. Because at the end of the day, we talk about the broken system with PBMs and the theft that comes with what they're able to do by these large multifaceted corporations owning the PBM and then controlling the healthcare delivery system. I've always been a big believer that the primary care doctor working in conjunction with the patient, coupled with a complementary insurance product or a complementary healthcare
Mhm.
infrastructure system, that those things ought to be working in tandem to drive outcomes for patients. Right now, we don't do that, so we've got a lot of work to do.
Awesome. And um, doing research on you. So you serve on health and welfare, labor and industrial relations, ways and means committees, and then you're also involved specifically in the Louisiana Rural Caucus too as well. And just out of curiosity, are you seeing a lot of the same kind of healthcare issues on the local level in Baton Rouge or even on the district level in comparison to what we're seeing in Washington, D.C.?
So yeah, so I think and again, that question is kind of loaded in a couple of directions. Rural health is different than our urban health and urban environments. These large hospital systems or insurance companies like to typically focus in the larger markets because of the getting people to the doctor, getting people into healthcare, having a higher volume of healthcare. It's easier in those larger markets. When you get to a rural delivery system, your payment methodologies have to be aligned a little differently because one, there are less patients, two, there are less payers, three, they're traditionally less affluent or poor in many cases, Medicaid-based patients. So that is the challenge between the disparities between rural and urban health. Now, DC is a very broken environment with a lot of hot air and little outcome. I think the rubber meets the road back in the rural markets. So the more we could do from federal policy standpoint of just driving federal resources back to our states and locals to invest that back into the healthcare delivery system, the better. I think you're starting to see a push at the DC level as this next administration comes in. We'll be more focused on Medicare methodology. And I got
Mm,
to be careful in saying that because Medicare methodology, there are good things that happen throughout the Medicare system, both on payment, DRG, and other things that innovate in a space where traditionally hospitals don't like to innovate. They just like to um, run services and bill for those services. So it goes back to the philosophy of outcome based care versus just fee for service. And that's at the core of the culture where we've got to shift to. Medicare has a payment methodology for that. But you also have to have the private market involved so there's innovation and continued competition to drive down cost and increase quality. So there's a lot of philosophy behind this, but it'll take a lot more in-depth policy to continue to innovate in that space.
yeah. And just out of curiosity, in your district, do your constituents do they have to if there's like a specialty um need that they must get, like do they have to drive to like a New Orleans or a Baton Rouge, or can they relatively get everything that they need within like Monroe and the surrounding areas?
So Monroe would be the kind of the center of healthcare for Northeast Louisiana. But you are exactly correct. If you get outside of this area, you're going to have disparaging or shortages in certain specialties and physicians. I've run several House resolutions that are we're studying that now to determine what our regions are missing by way of specialists. We even have urban markets that have specialty shortages, and that's all a product of your teaching hospitals and environment. Sometimes they may go teach a specialty that doesn't really benefit your region. So we have to be a little more tactical about this. And if we're going to grow a certain specialty line of business, that it contributes to the population and the needs of that population. So that analysis is going on now.
Hmm.
Right now, we're disjointed in Louisiana. By the way, our specialty medical education. Now, we do have a new School of Osteopathic Medicine here in my market, which is VCOM. They're out working towards solving the both rural and urban primary care health shortages that we have. I think given the next 5 to 10 years, we'll see a lot of those voids filled. So the next big leap is that specialty medicine and where we're having the shortages. Traditionally, when you see shortages, it's going to be in your Medicaid-based markets because the payments are unfairly structured. They're structured to go towards physicians at hospitals versus actually paying a fee for, well, a office visit fee and the things that are fair. So we've misaligned our payment methodologies in the rural healthcare space, and I think that's something that I've been working on for the last several years to realign and make it to where you can, keep your office up and running and still provide that care without just having to go out and do surgery on every Tom, Dick, and Harry. It's about that interaction early versus all the stuff you have to do to solve the problem at the end of the healthcare cycle, which costs so much money.
Awesome. And you bring up an interesting point because when I think of like healthcare, specifically in Louisiana, in relation to the 64 parishes, I tend to think of, Baton Rouge and New Orleans, but kind of what you just explained that there's a lot more outside of those, two big respective cities.
Yeah, those cities do have large specialty treatment centers, and you are going to have the centers of excellence where you would refer folks into. If you look at Mississippi, they have like a wagon wheel system where there's the center of the healthcare delivery system at the University of Mississippi Medical Center. They have lots of very unique specialists that are there that are trained in ways that you never could support in a rural market. Louisiana's a little bit more disparate that we've got these pockets of medical centers versus having one epicenter for these, very unique disease states you're trying to treat. So I think if we're going to be successful in the state, we need to look more of a wagon wheel method, but also having a variety of specialists, urology, cardiology, general surgery, and those types of things in the larger epicenters, the Monroes, the Shreveports, the Alexandrias, where people traditionally go for a little bit more advanced layer of care. Now, if it's a specific cancer or a pediatric issue that requires a high degree of specialization, you may go to a New Orleans for that. Or a lot of people are referring out of state. They're going to Little Rock to Children's, or they're going to UMMC or somewhere in Texas, maybe a facility like MD Anderson for cancer treatment. Again, this is all about having a cohesive strategy in our state for medical care, and we've not done the best job of that, but we're working on legislation and other processes and programs to try to centralize that and come up with a more cohesive strategy.
And and what is it, if you don't mind me asking, like what is the reason? Is it just like a shortage of physicians? Is it just like a lack of medical programs, or why is there a lot of referrals out of state?
It's because of lack of providers. And,
Oh,
when you have these smaller markets where you've got facilities that compete against each other and they
uh-huh.
go out and nobody specializes in anything and everybody's trying to hire, three interventional cardiologists. And instead of having a bunch of business for one facility, you've got a little business for two facilities. This goes back to that coordination of efforts around specialists throughout the state where you have these centers of excellence and actually have a strategy. We've been the wild, wild west, in my opinion, and haven't had that focus point. And I'm hopeful as I work with this administration and their efforts that we can be a little more focused and intentional with our delivery system.
Mhm. And how do you, not only as a state rep, but also as a human being, how do you want to contribute to the greater AI healthcare conversation that we're having?
I think from a policy perspective, I've tried to be ahead of the curve when it comes to, data interoperability standards, trying to make sure that patients' records are portable, trying to make sure that patients have access through digital delivery, whether it's through telehealth. I wrote some of the legislation in 2020 that opened the door for payment parity and telehealth, that opened up the door for more access as it relates to that. But that's only the beginning phase. The AI phase of this is, how do you, one, protect patients' data? That's very important with HIPAA. But even more importantly is how do you align incentives to where you can have a fair system that, insurance company can't just use AI to deny claims, but to figure out what core disease states may be out there through previous claims data, and then taking that data and being proactive. I think there are a lot of different strategies that we could employ to make all those things work, but we're at the cusp of something
Mm.
which I think is very, very special to making all these things work from a healthcare delivery standpoint.
And you know, with what you just said, where do you see the strengths and opportunities of District 14 to be an economic hub for AI healthcare development in the future?
So right now, because of the AI center, the metadata center in Rayville or Holly Ridge, I think that it just kind of sets the framework and the well, having that infrastructure here could actually be a ripple effect, and we have other healthcare and other delivery systems that link in just to have proximity to that multi-billion-dollar system of data and innovation. So what does that look like? We're developing healthcare assets here in conjunction with our economic development partners, ULM, coupled with some regional economics. We're working on some additional healthcare delivery assets that I think will contribute to research and development. So all those things combined, I think, create synergies, and that just gives us a lot of opportunity here, coupled with our pharmacy school and our medical school, and then the university to both innovate both in research and development.
Awesome. And then I got to ask you one last question, and I think it's the most important question. Uh, how do you think that the Tigers will fare against Baylor in the Texas Bowl?
Oh, of course, the Tigers are going to win.
Yeah. With Garrett Nussmeier, is it going to be like clutch Garrett Nussmeier, or is it going to be throw six interceptions in a game, Garrett?
I always would rather put the Tigers are going to make it all happen and come together. It's what they do right at the last, but I think it'll be a close game, but Tigers win by 3.
Yeah, awesome. And so, like a 2017, you're thinking 24-21,
I'm going to go with 27-24.
27-24. Awesome. Yeah, it's because
Yeah,
it's
so
in.
over and under them. If you're asking for Vegas odds here, I'm probably not the guy to ask. I don't bet so well.
Yeah. Well, and it seems like they always have great players, but for some reason, I don't know what it is. It's like they cannot get over the hump. Like I remember as a kid, like they went to a couple of championship games, but like they didn't win them. I think the last time that they won anything was 2003 when, I don't want to mention his name, but Nick Saban, you know.
Yeah, I'm glad Saban's retired. How about that?
Yeah, awesome. And Michael, where can people learn more about you and kind of what you're up to in Baton Rouge?
Sure, you can go to michaelechols.com, which is my website for my political focus. And then, of course, on Wednesdays, I have a radio show on 8 o'clock, Echols at 8. You can go to kmlb.com. Dylan, you've been on that one before, and I'm there every week at 8 o'clock. For 1 hour. Again, www.kmlb.com if you want to tune in. And again, if you can shoot me an email at michaelechols.com, I can answer any questions, or you can find my cell phone number there, but I'm easy to get in touch with.
Awesome. And be sure to subscribe to the AI Healthcare Podcast on YouTube and also listen to the audio version of this interview on Spotify and Apple Podcast. Michael, thank you so much again for your time today.
Thanks, Dylan. Have a good one.
This is Dylan Reed signing off.